Hi, everyone. Welcome back to another episode of Ask a Professional. My name is Ryan Abramski. I am the Business Development Director for EasyLiving. EasyLiving is a home care and care management agency serving the Tampa Bay area for over 20 years. This week on my Ask a Professional series, I am joined by Jennifer Madhi. She is from Kindred at Home. Jennifer is a registered nurse and also their senior clinical home health specialist. So Jennifer, thank you for joining me and taking some time out today. Really appreciate it.
Thanks for having me, Ryan.
Absolutely, absolutely. So Jennifer, tell us a little about yourself and exactly like what you do with Kindred at Home.
So my name is Jennifer Madhi. Like Ryan said, I'm a clinical home health specialist. I've been with the company for 12 years. I'm a registered nurse. I graduated from nursing school here in Tampa at University of Tampa. I'm a mom to two daughters. They're 4 years old and 19 months. I love home health. I fell in love with home health when I worked in the hospital, and I realized you can make much more of an impact on a patient's life at home.
Absolutely. And what exactly does Kindred do and Kindred at Home do?
So Kindred at Home we're a home health company. We've been in this area for over 40 years. We're the nation's largest home care company. We provide skilled services, including nursing, physical therapy, occupational therapy, speech therapy, home health aid, social work, and some locations have a psych nurse. And we would see patients in their home.
Okay, so yeah, so obviously, so you guys provide services in the home. Do you guys provide services like anywhere else besides a person's home? I mean, I guess anyone can consider a home. Specifically, maybe like an independent living or assisted living facility.
Sure.
Is that where you guys can also provide services?
Sure, we can provide services in any of those locations. Sometimes some of our patients are staying with a family member or they're staying at a friend's house, and we can provide at any of those locations.
Absolutely. So I know in our business, we're technically a home health agency. You guys are a home health agency, but you guys, there's a little bit of a difference between what the two of our companies do. So explain the difference between like a home health company and the skilled side of things and the home health, or actually known as home care side, on the non-skilled side that we do.
Sure. So for Kindred, we are we provide skilled services. So that would mean something along the lines of if you had, for example, a patient who may have some cardiac issues, and we would provide nursing, which is a skilled service, to go out and maybe help them with their medication or help them with their daily weights. Whereas a non-skilled company, which sometimes people refer to as private duty or more companion, may go out and assist that same patient with terms of, some house cleaning, some companion services, grocery shopping, transportation, things along those lines. Those aren't skilled, are not covered by insurance or Medicare like our services are, and are typically private pay.
Absolutely. Yep. And that's the thing, is I tell everyone, I said, the hard skilled stuff, we leave it to our home health companies to do that. Everything else, like the day-to-day operational things, is what we come in and help out with.
Sure.
So, do you guys have any like specialty programs or anything that you guys focus on? I know a lot of home health companies kind of all have their niches and different things. Like what do you guys focus on as far as like specialty programs?
Sure. So Kindred at Home has quite a few specialty programs that I'm very fond of. I'm a cardiac nurse by background, so I love our cardiac program. It's called our cardiopulmonary program, where we are able to help patients with any cardiac or pulmonary diagnosis. We front load their nursing visits so that they're getting the max benefit up front. We also provide therapy in on those cases. It's just a really great program. I'll show you. We use some things that we like to call our zone tools. So for every patient that may not necessarily want a giant binder or book of material, it would teach patients self-care in terms of a green zone, a yellow zone, and a red zone. So that's kind of a cool program that helps a lot of our patients. We also, in that program, along with our other programs, provide something that's my emergency plan, which is probably kind of hard to see there. But it just provides some nice pictures and, cues for patients that maybe aren't at a literacy level of understanding all the medical jargon of what they need to do. We also provide a fall prevention program called our Safe Strides program. There's been over 4,000 patients in a clinical study, and every single 95% of them have improved in terms of activities of daily living and reduced hospitalizations. We also provide an orthopedic program, which is very popular in this area. Mm-hmm. And we also have, which is very popular right now, a COVID program to accept COVID positive patients. So like I mentioned before, some locations provide psych nursing for behavioral health. And those are just a few of our programs that we kind of authorize to specialize. Something that makes Kindred a little bit different is we don't use any agency staff. So all of the staff belong to us. They've all been trained, background checked, certified through Kindred. So that's kind of nice in terms of, you're going to get somebody who's only working for Kindred.
Very good. Yeah, I know that's important because we did the same thing. There are employees, and we put them through our orientation too. And I know that means a lot to the families, especially when people are going into the homes. So last question, I'm sure everyone always likes to ask this, like, how does someone get these services? How do they pay for them? Who pays for them? That's always the biggest question, is about financing and money. How does someone get it?
So first off, to receive services, you would need a physician order or a nurse practitioner order. And now Medicare has kind of loosened up the restrictions. You don't necessarily have to go into your provider. So if you're not comfortable during COVID times to go in, you can do a telehealth visit as long as there is a video component to that visit. Sure. And all we need is an order to receive, for you to come out, us to come out and provide an evaluation to see if you qualify for the services. After that's done, we would send out a nurse or whatever service was offered to go ahead and evaluate you. If you're not sure 100% that home health is where you need to be, Kindred offers a national nurse line. It's 1-866-KINDRED, and 24 hours a day, 7 days a week is manned by registered nurses. And anybody can call, a patient, a family, a caregiver, and we can connect them with local services that would be appropriate for their care needs in their area, whether it's with Kindred or along another line that they may need. So that's a great resource and give back we can provide to the community. And like I said, it's not necessarily that you're interested in home health or we may fit what you need, but it's something that's a great give back. If you're just kind of wondering, watching this video, where can you start? We can help align you with some care.
Absolutely. Well, we're going to put all of your information for Kindred and Kindred at Home below. If anyone has any comments or questions at all, please post them down below in the comments section. You can always send us a message on Facebook or visit our website, EasyLivingFL.com, and we'll make sure to get you over to Jennifer and her team over at Kindred at Home to answer any questions that pertain to the home health side that they take care of. So, Jennifer, thank you so much for the time today. I really appreciate you joining us. And I thank everyone else for tuning in today. Hope to see everyone next time. Thank you so much.
Thanks, guys.